Hi. Can we start by you telling us who you are and what you do?
Yep, my name's Dr. Caroline White and I'm head of the CAPS Early Intervention Service in Manchester in the UK, and CAPS just stands for the Children Parent Service.
And can you please tell us what recognition your service has been awarded?
Yep, we've received some local recognition for service excellence in Manchester, and we've also been published by the National Institute of Health and Care Excellence as a model of best practice for both the treatment of behaviour problems and also for social and emotional wellbeing in the early years. We've also received some international recognition from the Incredible Years programme developer, Carolyn Webster Stratton, because we've successfully maintained a sustainable implementation of the programme for over 10 years.
Wow, that's really impressive. Tell us a bit more about the CAPS service and how it was set up in Manchester.
Well, Manchester is one of the most deprived cities in the UK, and it's actually ranked #1 for child poverty. So in Manchester we have a population of about 500,000 people, and there are kind of 32 municipalities, and 30 of those 32 are in the worst 10% of deprivation in the country. So we were tasked with setting up an early intervention service for preschool children and their families to try and target behaviour problems in 2 and 3 year olds. The idea being that if you do a thorough assessment, comprehensive assessment, and identify problems early, you can intervene with a really effective intervention and have better outcomes for children and families. So that's where it all began almost 20 years ago now. And it's always been a multi-agency project and partnership which involves social care, some education, some health and the voluntary sector.
And why is early intervention so important?
Well, to be honest, it's starkly obvious really that we really should be intervening early. There's over 30 years of research evidence now that demonstrates that intervening early is the best for child outcomes, but also the most cost-effective thing to do. And it's kind of interesting that people still ask that question, because we're so used to targeting our interventions at families who are in crisis, but often that's not the best time to intervene. So early intervention in terms of child development is most important because we can make a big difference. Like I say, we can get much better outcomes for families, but also save a lot of public money in the process of doing that. So there's a lot of evidence to support that we should be doing that now and continuing going forward with that approach.
Okay. So why did you choose Incredible Years as the main intervention for your service?
Well, Incredible Years is one of the most evidence-based programmes in the world really. It has multiple randomised controlled trials in different countries, in different cultures. We know that no matter how diverse the population, we still get good effective outcomes. So for example, in Manchester there are over 125 different languages spoken, and we have successfully implemented the programme with many of those families. So we know that it's culturally sensitive, we know that we get the same outcomes, even when the research has been conducted by independent researchers. So it's certainly got a robust evidence base, and we have looked at other evidence-based programmes, and for us, I think one of the most effective things about Incredible Years is actually the way it's delivered, not just the content, because I think Carolyn Webster Stratton has done a great job of describing the collaborative process, and actually it's those group process skills that are some of the most effective parts of the intervention. There are also some of the things that make it the most difficult to intervene, but I think that's what really gets the change. So for us, having something that had a really robust evidence base, ensuring that we did it to model fidelity, was the most important thing in choosing an intervention, and 18 years on it's still the best intervention. And I think when people ask about early intervention or using Incredible Years programme, it's we're desperate to find a cure for cancer, and I think we've got a really effective cure for behaviour problems, so the question should be why are we not doing more of it actually.
Okay. And what are the outcomes for children and families?
Well, we find the same outcomes as in the original research, so we know it reduces significant behaviour problems, even with children with diagnosis of ADHD and conduct disorder. We know that it improves social and emotional wellbeing in younger children and prevents the development of behaviour problems later on in life. So we also know that it improves significantly depression in the parents and reduces their mental health problems, and these findings can be followed up at 5-year and even 10-year follow-ups. So we know that families who've had the Incredible Years intervention very early on in life, going into young adulthood, they're less likely to have a teenage pregnancy, they're less likely to be misusing drugs and alcohol, they're more likely to be employed, they're more likely to have a successful relationship as an adult. So you can see significantly the better outcomes over the lifespan, but you can also very quickly see how much money that saves and how cost effective the intervention is. In Manchester, we have one of the highest rates of looked after children in the country, and the average cost of one looked after child is about £50,000 a year. The average cost of an incredible year's intervention is about £1,500. So I think you can see very quickly how you can save some of that public money.
And what measures do you use to evaluate the service?
We've always used some of the gold standard measures in our clinical practice, and we've done that for a couple of reasons really. Firstly, to be sure that we are doing the programme effectively to model fidelity, and to check that we're getting the same outcomes as in the original research. But also because we know they're the best tools to measure impact and outcomes. So it's much easier to explain to commissioners and people funding and the strategic managers supporting the programme what impact we're having. So we use the iBerg Child Behaviour Inventory to measure behaviour problems in young children. We use the Parenting Stress Index to measure parenting stress in the parents, and we also use the Beck Depression Inventory so that we have a measure of mental health. And we get significant outcomes on all three of those measures at pre, post and at 3-month follow-up routinely.
So how do you ensure that you get good data collection and analysis?
That's a really good question, because I think it's one of the most challenging things, and lots of services struggle to overcome that. With all the technology we've got these days, it should be easy, but in actual fact there's a lot of work involved in getting good data. So you need to consider who's going to collect the data in the first place, because that's very time consuming if you're going to do it face to face, which is the most successful way. You then need someone to input your data, which is also very time consuming. You then need somebody who can analyse and understand the data and make it meaningful for people, and we actually have a full-time information analyst in our service. We're currently running about 75 parent groups a year. We have a staff group of about 60 whole-time equivalents, and part of data collection, input and analysis is a big part of a lot of those job descriptions to ensure we collect and analyse good quality data. You then need people who can actually interpret it and write up the reports in meaningful ways for commissioners, because as I mentioned, there's over 30 years of research evidence telling us this programme works. But to be honest, most people are not going to read most of that evidence, and everybody wants to hear about local data. So if you can present your data meaningfully in a simple way that people understand, then I think you can get the message home much clearer and much quicker for people. So for us, it's really important that we not only collect the right data, but we present it well. So we always produce annual reports, and we're also very responsive to commissioners and strategic leads' requests. They often ask for different kinds of data, so we try to be flexible in our approach to make sure they have got a thorough understanding of what it is we're doing.
And how has the service developed over time?
Well, quite a lot. I guess the service began as half of my job and half a family support worker quite a long time ago. And over that time, we developed the service, we got some good outcomes, and then we bid for different pots of money actually. So we've always been a multi-agency service, we've always been jointly commissioned with a number of funding streams, and there's some real strength to that. That creates a lot of problems as well, because it's easy doing things in one organisation with one pot of money, but actually there's also some real strength in the diversity of working in a multi-agency way. It helps us access some of the harder to reach families, I think, and also your workforce has got a wider range of skills which can be really beneficial when thinking about hard to reach families and parental engagement. So that's always been our main approach really. Over time, as we became bigger and people really saw the benefit of the service, I think we got to a stage where parenting courses were almost universal in Manchester. There was a lot of early intervention funding available in the UK at the time, and we expanded as such. In the last 3 or 4 years though, we've been hit by the largest public sector cuts in history, and that's been massive in Manchester. So the whole budget for early years has been cut from 29 million down to 7 in just 2 years. And what's really interesting for me is that at a time when there's been even less money, we've had our biggest scale up and our biggest increase in funding, because I think our commissioners have understood that actually when there's very little money, we really should be spending it on things that we know are effective and actually work. So in actual fact, we've gone from being quite universal provision to much more targeted now. Our commissioners want us to identify need in the hardest to reach populations at the highest risk and get in as early as possible for, really effective outcomes, but also to save some of that money. So I think it's quite significant and interesting that we've survived those public sector cuts, because virtually everything else has been decommissioned. And I think the reason that we've survived that is because of our robust evidence base and because data we collect. It's very clear that what we do is high quality work.
So why have commissioners funded the service for so long?
Well, I maybe already partly answered that question, I think, really. But I think it is absolutely because of the data we've always collected, and also that we've always insisted on doing the programme to model fidelity. And that sounds very easy when you just talk about it, but actually putting it into practice, making sure that your workforce is trained and skilled to the highest standards, that they're accredited, that time is built into people's job plans to attend supervision. All those things are really crucial if you're going to do the programme properly and effectively. So I think that what commissioners have seen is that we're a high quality service, but without a doubt our data is the reason we've survived those public sector cuts. So going back to what I was saying earlier about how important that is to build into your service, I think it's one of the things that people pay least attention to, and yet it is one of the most important factors.
So what have been the key challenges to building a sustainable implementation?
Again, that leads really nicely onto what I was just saying, I think, because in my service, we do want our staff to be accredited. We want them to receive regular video supervision as per the original programme, and that's really very important. When you're working in a multi-agency way, it is difficult when maybe other managers see that there are other priorities in that person's service. So the thing that usually goes first is the supervision or the time to do that self-reflective practice. And we know, again, from the evidence base that if you don't have accredited group leaders, if they don't receive regular supervision and if they don't follow the original manual, you're not going to do the programme the way it was done in the original research, and then you're not going to get the same outcomes. So some of the big challenges really are educating and helping commissioners and strategic managers to understand the importance of that supervision and that ongoing supervision. Even after 15 years, your workforce still needs really high quality supervision, because without that you do get practitioner drift, and then you're likely to impact negatively on your outcomes for families. And actually I think families deserve the best quality intervention that we can possibly give them, and if we're going to do that, that really does mean we need high quality services. There's also some technical things, so because the supervision is video based, then services need to video all the interventions they do, and they need to have the equipment to do that, which can get very complicated with things like information governance in different organisations. These problems are all problems that have got good solutions, but it takes time and effort, and I think often it's the kind of maybe senior managers or even middle managers who don't understand the impact of some of those things, and that can get in the way sometimes of things working effectively. I think another big problem is also that people perceive the programme to be very expensive, because the initial training costs and upfront costs of buying materials does run into several £1,000s. But actually, when you look at the cost-benefit analyses that have been done on all the interventions and research in Incredible Years, we do know that the more money you invest in Incredible Years, the more money you save in the long term. So I think one of the key strategies is to really educate commissioners and managers to understand that. And unfortunately, they do want quick and easy answers. And if I had £1 for it every time someone asked me to do it quicker, faster, shorter, cheaper, then I'd be a millionaire-ess. But the moment you do that, you dilute the intervention. And again, going back to the analogy with a treatment for cancer, if somebody needs 14 sessions of radiotherapy, then that's what they get. And there'd be an outcry if anybody said, well, actually, we'll just give them 7 sessions because that's a bit cheaper and quicker. But people do that with psychological interventions, and actually it's just as risky.
Thanks. So finally, what advice would you give to someone setting up a service delivering Incredible Years parent programmes?
I would say be ready to be persuasive, be ready to be persistent, and Absolutely start small in the first place. I think lots of implementations begin with a small pilot and they get good evidence, and then they immediately want to scale up to like the size of a country or a really large geographical region, and that's not always the most successful way. Because that, there's all those steps we've just been talking about that need to be put into place. So I would recommend that people do start fairly small, and then don't scale up immediately, but actually look for other areas who are enthusiastic and keen to replicate, what you've got in the first place. Work with people who are ready to transform their services and do things a bit differently, and who understand the cost-benefit analysis and the long-term gains that can be involved in this. So start small and then spread gently. I'd also highly recommend that you use the gold standard measures and that data that we've talked about, because without that you can't demonstrate why you're spending this investment, or you're not very much of an argument to overcome some of those obstacles. So I think collecting really good robust data and publishing that data in easy to read reports, just maybe 2 or 3 sides long so that people actually read them. And don't be afraid to tell people about the great work that you're doing so they can really understand the impact that it's having. I'd also recommend that from a strategic level that there's some kind of multi-agency steering group. We've always had some kind of partnership with other organisations, managers and strategic leads, and those structures have changed over the 20 years, but we've always been key partners on those boards and meetings. So we're working at both a strategic level but also at a frontline worker level. So I think, encompassing all of those things and educating the people you're working with about why you're doing it are actually key to success.
Thank you very much for your time, Dr.
You're welcome, thank you.